Hi, and welcome to the first video in a series from the Parkinson's Disease Mobility Clinic. What I'd like to talk to you today about is exercise for people with Parkinson's disease. My name is Melissa McConaghy and I'm a specialist neurological physiotherapist and founder of Advanced Rehab Centre located in St Leonards, Sydney. In our clinic we see people with all levels of Parkinson's disease starting from very early diagnosis. Many of the complaints we hear are about the slowness of movement and the size of the movement. People complain about giving up many of their daily activities, such as putting on face cream because it's too hard to take off, or they've stopped reading the paper, stopped writing perhaps, or stopped using cutlery. Many of these symptoms are related to the primary impairments of Parkinson's disease. Hypokinesia is small movements. Bradykinesia is slow movements. These are often hallmarks of Parkinson's disease. Down the track, people may also complain of akinesia, difficulty initiating movement, taking that very first step. Often people will complain of a sensation of having their feet glued to the floor, particularly coming up to doorways or walking through cluttered furniture. We often hear complaints of difficulties with balance and falls or loss of confidence, with tremor, stiffness, rigidity, and perhaps if people have been on medication for a long time, they may complain of involuntary movements and dyskinesia or dystonia. What we also see in our clinic are sedentary behaviour cycles, where the primary impairments have led to the initial physical decline, which can lead to impaired mood and loss of motivation, which leads to inactivity, loss of function, depression, and further physical decline. This can become a vicious cycle. Secondary impairments related to this decreased movement and vicious cycle can lead to reduced cardiorespiratory fitness, weakness and contracture, soft tissue shortening, falls and near misses, depression and fatigue. Ultimately, this can lead to decreased quality of life. So, how can exercise help? We know that optimal medication is very important for people with Parkinson's disease, so it is important that you speak to your neurologist about the optimal medication program for you. What we also know is that exercise programs, any exercise, will improve your function. So with your optimal medication and the right exercise program, this will increase your quality of life and function. The physical benefits of exercise for people with Parkinson's disease are very similar to those for the normal population. Exercise helps to maintain mobility and independence, to improve muscle strength and length, to maintain cardiovascular fitness, to improve balance and coordination, and to improve posture and flexibility. So what type of exercise is best? It is important that your exercise program is tailored to you and your needs. Do you need an endurance program, looking at your fitness and cardiac reserve to keep you doing the things that you like doing during the day? Or do you need a resistance training program to keep your strength up so that you can get in and out of chairs, in and out of the car, up and down stairs comfortably? Or do you need something more specific such as balance training, or perhaps a combination of all three? Some of the types of endurance exercise programs you might see are cycling, treadmill training, or going to your local pool or a hydrotherapy centre. This can be done either as a circuit or in a group, or independently, or with a health professional. Types of resistance training programs often include functional activities such as sitting to stand, getting in and out of chairs, up and down stairs, or maybe going to your local gym with your physiotherapist or health professional. Sometimes you can do very good resistance training exercises in the pool as well. Other types of exercise include programs like the LSVT Big program, which we have just launched in Australia at our clinic in St Leonards, Sydney. This is a very exciting program. We've had some very exciting results. It's the first time we've been able to target the primary impairment of bradykinesia. LSVT Big was developed in the United States and is a Parkinson's disease specific intensive whole body exercise intervention to decrease bradykinesia through amplitude-based training. The goal of the program is to produce bigger and faster movements in everyday life, with everyday activities that make the program sustainable for long-term carryover of the increased amplitude use. So when do you start exercising? Early intervention is probably the easiest and the best way to manage your daily activities. At initial diagnosis, we recommend that everybody is referred to a physiotherapist for an exercise program specific to them. If there's been a sudden increase in your symptoms, or you found that you're just not getting around like you used to, that's another time that you probably needs to be reviewed by a physiotherapist. Or if you're new to exercise or you have a change in your medication, it's also a good time to be reviewed by your physiotherapist. So who should prescribe exercise? It is important to get the right information and the right education from an appropriate health professional, and I would recommend seeking a neurological physiotherapist from the team at Advanced Rehab Centre. We can come out and see you in your home if you live in metropolitan Sydney, or you can join us at our clinic in St Leonard's. A local physiotherapist will also have knowledge of the exercises that are appropriate for people with Parkinson's disease, but perhaps not to the same level of knowledge. An exercise physiologist may be an appropriate health professional to help you conduct your exercise program once you've seen a neurological physiotherapist. A personal trainer may be also used if you'd like to go to a gym or you'd like somebody that you can be accountable to and can help you to keep your program going. You may also wish to buddy up with a friend or a family member. This can help to keep you motivated and working through your exercise program, but perhaps not to have them suggest the exercises that you should or shouldn't be doing. And where to? Anywhere that you feel comfortable, somewhere that you can be motivated and you can receive the right kind of support. We would recommend a specialist physiotherapy centre to get you started, and then perhaps setting you up with a program at home, perhaps your local gym or your local pool or a community centre. What else can physiotherapists do? We can provide home assessments. We can come to your home and have a look at what you're having trouble with in and around your home. Perhaps we can provide you with an exercise program safely set up with the right kind of equipment. We can refer you to an occupational therapist if you have other equipment needs or you need modifications to make your home safer. We can provide you with cueing strategies such as visual or auditory cues to keep you moving. Other movement strategies may include training, specific tasks such as getting out of bed, getting up out of chairs, etc. Linking in with other health professionals is very important as part of your overall support network, and we can liaise with occupational therapists, speech pathologists, your neurologist and family members. Education and advice is very helpful to make sure that you're empowered and you're in control of your rehab program. And physiotherapists can also support you in your overall rehabilitation program. It's important to note that people with Parkinson's disease can get better. Use it and improve it. The LSVT BIG program is more effective than traditional therapies when combined with medical management. Inactivity is pro-degeneration. Exercise is neuroprotection, so keep moving. The intensity and the effort of your movement also matters. It makes a difference physically and mentally. Early referral is best. It's never too late, but it's much easier the earlier you get in to see us. Exercise can make a difference in mobility, independence, quality of life, keeping you at work and maintaining your dignity. There is so much that physiotherapists can do for people with Parkinson's disease, so spread the word and give us a call today. Thank you very much for joining us today.